Good day from the Philippines. I'm Dr. Debbie Guani D. Meguizo, President of the Philippine Society for Reproductive Medicine. PSRM was founded in 1994 with a vision to dedicate ourselves to providing excellent patient-friendly healthcare by the advancement of professional growth through the development of its subspecialties, research, continuing medical education, innovative technologies, and the regulation of training, practice, and cost-effective services related to the specialty. The mission of the society is to make experts committed to the noble promotion of competent and ethical practice of reproductive endocrinology and infertility. The country has three accredited training centers that offer clinical and research fellowships and one training program offering a pure IVF fellowship. You have the University of the Philippines Philippine General Hospital, St. Luke's Medical Center, and the consortium of Nicanor Reyes Medical Center, Jose Reyes Medical Center, and Capital Medical Center. Since 1989, over 33 years, the three training institutions have produced 139 experts committed to the noble promotion of competent and ethical practice of reproductive endocrinology and infertility. IVF in the Philippines started in 1996 with the first IVF baby born in the same year. Currently, we have 7 accredited IVF centers and we're expecting to have more clinics in the coming years. There are challenges to the reproductive health services in the Philippines. The ART data collection. Despite the fact that the first IVF center was in 1996, the society did not have an organized data until 2015. And then there was a steady rise of cases leading up to 2020. Unfortunately, the pandemic has drastically affected the total number of cycles. The Philippines is a predominantly Catholic country. Clinicians, patients, and relatives having apprehensions about assisted reproduction. So much so that it took quite some time, almost a decade, for people to accept the idea of in vitro fertilization. Majority of the population belongs to the lower and lower middle class economic strata and cannot afford treatments. There is a lack of knowledge about reproductive health in general and fertility options in particular. Healthcare is not subsidized by the government. Women's health care remains marginalized and underserved. The laws are silent with current needs, and drugs used for in vitro fertilization are relatively more expensive compared to neighboring areas. In the Family Code of the Philippines in 1987, children conceived as a result of artificial insemination of the wife with the sperm of the husband or that of a donor or both are likewise legitimate children of the husband and his wife, provided both authorized a written instrument executed and signed before the birth of the child. Another challenge is access to fertility care. Specialists practice more at the metropolitan area and not all practice ART. To improve fertility care, the society is working towards increasing awareness of the disease by conducting lay fora, dialogues with lay group, and continuing medical education in the form of regular webinars, conventions, and workshops. Other challenges include the development of a good referral infrastructure, lack of policy on subspecialty care for infertility, laws for third-party in vitro fertilization, and cost of PGTA. Allow me to present the ART outcomes of the Philippines. On the clinical pregnancy rate in fresh embryo transfer, there's an increasing trend towards blastocyst transfer and a decreasing trend on cleavage embryo transfer. Live birth rate is higher in blastocyst transfer compared to cleavage stage transfer. In frozen embryo transfer, blastocyst with or without PGTA has similar clinical pregnancy rate, but live birth rate showed higher pregnancy with PGTA of 80% to 83% singleton pregnancies for cleavage stage transfers, which is almost the same, around 78 to 83% singleton pregnancies for blastocyst transfers. There is a 0.4% incidence of ovarian hyperstimulation syndrome, 0.16% ectopic pregnancies, and 0.08% cases with birth defects. Most of our centers performed TESE, and one hospital-based center performed a number of micro-TESE. Special procedures include time-lapse videography-assisted cycles and ovarian tissue cryopreservation. The ultimate vision of the Board of Reproductive Medicine is to provide the highest quality standards of education, training, research, and AMP service towards certification for the specialty practice of reproductive endocrinology and infertility. We have a committee on research and development to promote scientific activities in the field of reproductive medicine. The Philippine Journal of Reproductive Medicine was launched in 2004, and it ensures compliance to Western Pacific Region Index Medicus. The ART Regulatory Board, formulated in 2011, regulates the practice of ART, ensuring the standards of ART laboratories, integrity, and expertise of ART practitioners. These are the PSRM Board of Directors for 2022. And our International Federation of Fertility Society Philippine representative, Professor Eileen Manalo. Our society's strength lies in its 139 members. We are recognized not only as a national leader in fertility care, but also as an important voice in obstetrics and gynecology. Deeply ingrained in PSRM is a culture of excellence and mentorship that encourages our younger members to stand on the proverbial shoulders of giants. This allows a unique perspective that mixes wisdom from experience and vibrance of youth. We can categorically say that each member is a leader in his own right. The future is bright for reproductive care in the Philippines, and we are grateful for this opportunity to celebrate with you. Thank you and congratulations.